So how do the health records work?
When a new patient enters the IMC hospital, he fills out a form where he writes all his details, such as his name, birthday, and other important details. After he fills out this form, a nurse or worker takes the form and creates a record for the person in the IMC database. The IMC database is basically a folder and servers made specifically for that person. Afterwards, all the x-rays, test results, or any other important medical information related to the person are placed in this folder and can be accessed by any medical staff with high enough clearance. Along with the medical piece of information in the folder, there's a digital copy of the form the patient has filled out previously so that the doctors can learn more about the patient, and also so that the patient will not have to fill out these forms again when they return. This is what is commonly known as the electronic health record, or EHR for short.
So is there a way to distinguish between two patients who have similar information, such as birthdays or first names?
Of course, every patient is given an ID number, which distinguishes them from any other patient in the IMC database. When the order or doctor type in the ID number, the electronic health record related to that ID number pops up with the information in the photo. The photo is of the person, so they confirm that the ID number is for that particular patient. This can be done from any computer in the IMC network, as long as it is a valid ID number, and the person checking the ID has high enough security clearance and access. Also, when the records are created, we offer to give the patient a card, which contains the ID number, so that in case of an emergency, the card can be swiped and the information will immediately pop up as instructed.
You mentioned security before. How exactly does the security protocol work in the IMC?
Anyone at the IMC can access patient records. They need to have a security clearance high enough to access the records. This is to prevent anyone from accessing patient records and breaking the doctor-patient privacy confidentiality. Also, an even higher security clearance is required to copy records from one device to another, so that the records never leave the IMC unless it's absolutely necessary or it's an emergency. The IMC servers keep track of all exchanges that occur in the network, so that if anyone which breaks protocol does copy the records, we can trace who broke the rules.
Any final thoughts or comments?
Yes, I personally believe that the electronic record method is much more efficient and effective than the previous paper method. It has a lot more space in the hospital, as the digital records take much less space, and also allows for faster methods for finding and updating the records. These changes come with a price. The staff need to be trained. There's a lot of maintenance that needs to be carried out, of course at a higher cost. However, at the end, I think that the positive effects are much more important than the cost of the system.
Thank you for your time.
You're welcome.